Organ transplant is becoming an integral part of modern medicine. It is a form of treatment that is saving lives and improving the quality of life of people, including children. In our discussion, we will focus on the ethical dilemma of having Sarah, a 7-year-old girl, donate bone marrow to her 14-year-old sister, Rose, who is diagnosed with acute myeloid leukemia. Acute myeloid leukemia is a form of cancer, and it occurs when bone marrow begins to make blast cells that has not yet completely matured.
Yeah, so the reason that she would need to donate blood to her sister certainly is because they're going to ablate all of the bad cells in her sister Rose, and then Sarah's bone marrow will be used to harvest stem cells, which will then be given to her sister. And hopefully those will help her sister develop healthy bone marrow, and that's really the goal. Now, the bone marrow stem cells are directly aspirated from Sarah's hips in the posterior iliac crest, right? And they usually use general or regional anesthesia for that, and it can be done as an outpatient procedure now, which is great. And it's used for about 20% of the stem cell donations. The other 80%, 10% are done with cord blood, and then 70% are with peripheral stem cell retrieval, which is a prolonged process. But apparently Sarah's sister's Rose, the doctor is not determined that that's going to be the best technique for her.
Okay, I think that's good, because 50 years ago, acute myeloid leukemia was seen to be incurable. Today, with all these advancements in medicine and technology, patients over 60 years or younger with AML have a 35 to 40% cure rate, while patients older than 60 years have about 5 to 15% chances of being cured.
Well, and it's really cool that they're able to use the bone marrow or the stem cells nowadays to treat not only the leukemias that we just mentioned, the acute leukemia, the chronic leukemia, non-Hodgkin's lymphoma, but it also can be used for genetic disorders and for autoimmune diseases and different types of anemia as well. So it's a very broad area, and the most common purpose, though, when you look at sibling donations is for the AML or the leukemias.
Okay.
So when it comes to getting consent from the donor child, we want to make sure that we're keeping beneficence or acting in the child's best interest in mind. And when it comes to protecting the child's best interest, oftentimes the donor child is assigned a donor advocate, okay? And the donor advocate is there to help the donor and the parents understand the process and the procedures, and it promotes the best interest of the donor. And typically the donor advocate has some training in childhood development and child psychology. They have great skills with communicating with children, and they understand children's nonverbal communication. So they're able to pick up on any pushback from the child, and can really be that child's advocate.
I think so. Still, if we try our best to minimize the ethical implication of a donor, in this case Sarah, so still there are ethical dilemmas which is inevitable to avoid. Some of them are happen is because those minors are not fully understood the circumstances, and in traditional medicine, parents are the one who consent on behalf of their kids. But in this case, so a donor has to be addressed the ethical process, as you say, by donor advocates. So the American Academy of Pediatrics Committee on Bioethics has said 5 standards before we say go for a donation, and those are: first, much are available much are available, not available for adults. And second one, if the bone marrow transplant must confer a reasonable benefit to the recipient. And the third is strong personal relationship has to exist between the donor and the recipient. And the fourth is the risk and the benefit of donation has to weigh out. And the fifth is the consent. And the patient has to be assent in this case. So,
Yeah.
So
I
if
think-
we look at that, I was going to say, if we look at that list for Sarah and Rose, right? So the first criteria was,
the first criteria was the parents. Excuse me, I have to go. I'll eat this part
that's okay.
myself.
That's okay.
So, first, like from the 5 criteria, the first one is no adult mice are available, so that we just take the minors as a donor.
Okay, so we've already met that criteria for Sarah and her sister. Okay.
That's the second one is the bone marrow transplant must be confer a reasonable benefit to the recipient.
And since Bernard just explained
He
how
said
successful
how
it can
successful
be.
it can
Yes.
be, so it is very much looks good for this case. And the third one is a strong personal relationship exists between the donor and the recipient. In this case, they are siblings.
Yes,
Siblings,
sisters, so
and
Right.
the relationship's been determined to be pretty
So
strong.
the fourth condition is the risk and the benefit of a donation. And in
Right.
this case, you just mentioned a good point. We have to weigh the benefit of the recipient, but
Well, and the risk
And the
for the patient, so the physical risk for donations or donors include the fatigue at the time of collection. Other things include a persistent pain at 1 week and sometimes even at 1 month after collection. Complications from general anesthesia might include things like a sore throat, mild nausea, or vomiting. Regional anesthesia could include things like hypotension or a postoperative headache. Most people are pretty normal within a week to 3 weeks. However, 1% of the donors have reported more serious complications. So those things need to be made aware to her too, to some extent. Things, for example, like bone, nerve, muscle, or tissue damage at the site where the cells were retrieved. And then occasionally, certainly rare morbidities like pulmonary embolism or sickle cell crisis or death can occur. Usually that happens though in less than 1 in 10,000 cases. So the risk is there, but it's not as great as many other procedures.
that's true. And the fifth condition, which is pulls our ethical dilemma to the center, is the consent. And parent has to consent in this case, but also the patient or the minor has to give an assent. And in this case, Sarah is in a condition where she cannot just fully consent or give an assent, and there are things that influences her condition. So in order to do that, to help her on her decision, those
The donor advocate
donor advocates
definitely comes in. And I think it's great that, that they require the child to assent. It's important for the donor to be, involved in this, and it's important for the donor to make sure that, it's appropriate for to go through with this. And the assent helps the donor achieve developmental appropriate awareness about the transplant and explains to the donor what they can expect in terms of treatment, and it helps the donor just get an overall understanding of the clinical situation. So, and that's where the donor advocate comes in with the assent aspect of the consent.
And this can take us to Pavlov's theory. The Pavlov's theory is mainly for adults, but it can be applied to children in this case. So what you mentioned, the parents have to consent for the children, that's good, because the parents have some relationship, they have some bond with the children, so they are the best people to talk. They are in the position to get consent, assent from the child. So Pablo, then it relates to their relationship. In other words, there's some interpersonal relationship between the parent and the child. So now the consent process can be attained. Okay?
True. And also the assent actually helps mainly the kid, because assent is obtained from the donor, in this case Sarah. And Sarah actually asking her for her assent is a good thing because it gives her an autonomy on her donation, and that also builds a relationship to her sister, that she did something on behalf of her sister, and that also improves the bonding in the family. And that's one thing that we need to assure, that we need to get the assent.
Okay.
Is that all?
Yeah, I think for now, okay.
This is a good